Visceral relations. The visceral surfaces is related to the fundus of the stomach, the anterior surface of the left kidney, the splenic flexure of the colon, and the tail of the pancreas. The gastric impression for the fundus of the stomach lies between the superior and inferior quarters. It is the largest and most concave impression on the spleen. The renal impression for the left kidney lies between the inferior and inferior. This is the diagram and show the relations of the visceral spleen. You can see in the left suprasplenic splenic artery, splenic pancreas, left spleen, splenic flexure of colon, tail of pancreas. The colic impressions for the splenic flexure of the colon occupies a triangular area adjoining the anterior end of the spleen. Its lower part is related to the phrenico-colic ligament. The pancreatic impression for the tail of the pancreas lies between the hilum and the colic impression. The hilum lies on the infromedial part of the gastric impression along the long axis of the spleen, or it transmits the splenic vessels and nerves and provides attachment to the gastrosplenic and lienorenal ligaments. Diaphragmatic surface. The diaphragmatic surface is related to the diaphragm, which separates the spleen from the costodiaphragmatic recess of pleura, lung, and 9th, 10th, and 11th rib of the left side. Arterial supply. The spleen is supplied by the splenic artery, which is the last branch of the coeliac trunk. Venous drainage. The splenic vein is formed at the hilum of the spleen. It runs a straight course behind the pancreas. It joins the superior mesenteric vein behind the neck of the pancreas to form the portal vein. Its tributaries are the short gastric, left gastroepiploic, pancreatic, and inferior mesenteric veins. Lymphatic drainage. Splenic tissue proper has no lymphatics. A few lymphatics arise from the connective tissue of the capsule, including trabeculae, and drain into the pancreatico-splenic lymph nodes situated along the splenic artery. Nerve supply. Sympathetic fibers are derived from the colic plexus. They are vasomotor in nature. They also supply some smooth muscle present in the capsule. And the last one is the functions of the spleen. First is phagocytosis. The spleen is an important component of the reticuloendothelial system. The splenic phagocytes include the reticular cells and free macrophages of the red pulp, modified reticular cells of the polypozoids, free macrophages, and endothelial cells of the venous lymphocytes. Surfaces reticular cells of the lymphatic follicle. The phagocytes present in the organ remove cell debris and old and defect RBCs, other blood cell and microorganisms, and thus filter the blood. Phagocytosis of circulating antigens initiate humoral and cellular immune system. Second is the hemopoiesis. Hemopoiesis. The spleen is an important hemopoietic organ during fetal life. Lymphopoiesis continues through life. The lymphocytes manufactured in it take part in immune responses of the body. In the adult spleen, Hemoptysis can restart in certain diseases like chronic myeloid leukemia and myelosclerosis.